Hi and welcome back to our page. Back in October 2024, a government review found that the CQC had lost credibility in the health and social care sectors. The Health Secretary, Wes Streeting, stood up in Parliament and called them not fit for purpose. That review, the Penny Dash review, didn't just criticise CQC, it exposed fundamental problems with how they were operating, problems that had been building for years. Problems that meant providers like you weren't getting fair, timely or accurate assessments. What followed was a complete overhaul. New leadership, new scoring methods and new registration processes, and a massive push to clear the backlog of uninspected services. But here's what concerns me. Most providers I speak to, they're still preparing the old way. They're still using advice from 22 or 23. They're still focused on the wrong things entirely. In this episode, I'm going to break down exactly what changed, what the Penny Dash review actually found, and what you need to do differently right now in 2026, because your next inspection is not going to look like the ones you remember. Right, let me tell you what Dr. Penny Dash actually found when she reviewed CQC's operations, because understanding this helps you understand why everything's changed. Finding 1. Inspection numbers had collapsed. In 2019 to 2020, CQC carried out around 16,000 inspections. By 23 to 24, just 7,000, less than half. Finding 2. Services were waiting years for re-inspection. The time to re-inspect an inadequate rated service, where people might genuinely be at risk, had increased from 87 days to 136 days, and that was just the inadequate ones. Finding 3. CQC had lost sector expertise. When they restructured, they moved away from having inspectors who specialised in specific sectors, so you might have someone inspecting your domiciliary care service who'd spent most of their career in hospitals. The review found that this was causing inconsistent judgments. Finding 4. The new single assessment framework was too complicated. When they rolled it out in late 2023, inspectors were having to score every evidence category for every quality statement. We're talking about over 97 individual scores for a single home care assessment. It was taking forever, and frankly, it wasn't producing fair results. Finding 5. The iTeam systems were a mess. Providers couldn't upload documents properly. Password resets were taking days. The digital portal that was supposed to make everything easier, it never properly materialised for thousands of services. Ultimately, the review was damning, but it also forced change, real change. Where does that leave us now, in January 2026? Let me hit you with some numbers. According to the Home Care Association's analysis from last summer, over 70% of domiciliary care providers either had no CQC rating at all, or they have a rating that's more than 4 years old. Let that sink in. 7 out of 10 services. Breaking that down further, about a third of all community social care locations have never been inspected. Never. They've registered, they've started operating, and CQC just hasn't got to them yet. Some have even been waiting for over 5 years. The sector has grown massively, from around 9,000 registered locations in 2017 to over 14,000 now, but CQC's capacity hasn't kept pace. At the inspection rates we saw in 2024, the Home Care Association calculated it will take 16 years to inspect every service just once. Now, you might think, that's great, less chance of being inspected, but here's why that's dangerous thinking. CQC is under massive pressure to fix this. They brought in a new chief executive, Sir Julian Hartley. They've appointed chief inspectors for each sector again, and they've been ramping up assessments significantly. In November 2025, they completed 50% more assessments than November 2024. 2026 is the year they're pushing hard to catch up. The wave is here, and when your inspection comes, it could be at any time. There's no schedule you can rely on anymore. Let's talk about what's actually changed in how inspections work. I'll keep it clear because this really isn't complicated once you see it. Change number 1, the key lines of inquiry are gone. The KLOEs that every registered manager knew inside out, they've been replaced. Over 300 prompts, all gone. In their place, 34 quality statements organised under the same 5 key questions you know: safe, effective, caring, responsive and well-led. But here's the crucial difference. These quality statements are written as we statements. They describe what good care looks like from the provider's perspective. For example, under safe, one statement says, we have a proactive and positive culture of safety based on openness and honesty, in which concerns about safety are investigated and reported thoroughly, and lessons are learned. The caring, we treat people with kindness, empathy and compassion, and we respect their privacy and dignity. These aren't tick boxes. You can't just say, yes, we do that. You need to evidence that you do it through multiple sources, but that's the shift. Change number 2, the scoring system was rebuilt. In 2024, inspectors were scoring every evidence category for every quality statement individually. For a home care assessment, that could mean over 97 individual scores. It was a nightmare. Too complicated, too slow, and honestly, it wasn't given a fair picture of care quality. The Penny Dash review called it a pseudoscience. So in December 2024, they scrapped that approach. Now, inspectors use professional judgment to give a 1 to 4 score at the quality statement level, not at the evidence category level. So what does professional judgment mean in practice? It means the inspector looks at all the evidence across all categories for each quality statement, then makes a holistic assessment. They're not mechanically adding up sub-scores anymore. This can work for or against you. If your evidence tells a compelling story across multiple sources, you'll benefit. If you're relying on documents alone while other evidence is weak, then you'll struggle. Now over to change number 3. And this is the one that changes everything about how you prepare. The 60% of the evidence CQC collects is now feedback-based. Let me say that again. Over 60% of the evidence CQC uses to judge your service is feedback, not documents, not policies, feedback from actual people. CQC groups evidence into 6 categories. Let me walk you through each one. Category 1, people's experience. This is feedback from people you care for, their families, their advocates, and CQC will phone your clients. They'll use feedback forms submitted through your website. They'll look at your own surveys and compliment logs, and they want to hear directly from the people receiving care. Category 2, feedback from staff and leaders. Your team's voice. CQC will often make hour-long phone calls to your staff. They might send questionnaires with 20 or more questions. They want to know if your staff feel supported, trained, and able to raise concerns. They'll look at your staff surveys, supervision records, and meeting minutes. Category 3, feedback from partners, GPs, social workers, district nurses, occupational therapists, commissioners, anyone who works with you. CQC will ask for contact details of professionals you've worked with in the past year, and they'll reach out directly. What those professionals say about you matters enormously. In category 4, observation, what inspectors see directly. For domiciliary care, this might be limited. They can visit everyone's home, but they may accompany carers on calls. They'll observe your office environment. They'll watch how staff interact. Category 5, processes. This is your policies, audits, training records, care plans, risk assessments, MAR charts, incident logs, governance documents, the paperwork essentially. This is what most providers focus on. Category 6, outcomes. The measurable impact of care on people's lives. But for domiciliary care, this category isn't really used in assessments. Now look at that list. Categories 1, 2, and 3 are all feedback, people's experience, staff feedback, partner feedback, 3 out of 5 categories that apply to domiciliary care. Here's what we see constantly. Providers spending 90% of their time on category 5, documents and policies, while completely neglecting the 3 categories that carry the most weight. If you're not proactively collecting amazing feedback and tying it to the quality statements, you're leaving your rating to chance. One more change I need to mention, especially if you're thinking of expanding or if you know anyone starting a new service. In July 2025, CQC introduced a new 2-stage registration process for domiciliary care providers. This replaced the old single-stage approach. Stage 1 happens before registration is granted. CQC assesses your foundations, your statement of purpose, your policies, your training plans, your complaints procedures, and your service user guide. They want to see you're set up properly before you start. Stage 2 happens after registration, once you've started delivering care. CQC will assess how you're actually operating, whether reality matches what you promised. Essentially, the message is clear. CQC wants providers to be ready before they start caring for people, not scrambling to get compliance afterwards. It's more rigorous upfront, but it also means fewer failing services entering the market. What does all this actually mean for you, practically? It means your preparation strategies need to shift fundamentally. Yes, you still need your policies in place, and you still need your care plans and risk assessments, and you still need your training matrix and staff files and MAR charts and incident logs. That's your baseline. That's your table stakes. Without that, you fail. But that's not what separates good from outstanding. That's not what separates requires improvement from good. What separates the ratings is evidence of impact through multiple voices. Essentially, can you show that the people you support are genuinely thriving, not just safe, but living well? Can you show that your staff feel valued, supported, and able to speak up when something's wrong? And can you show professionals who you work with that you are trustworthy, they can rely on you, and they would recommend you? The old mindset was, have the paperwork ready. However, the new mindset needs to be, can I show through multiple voices that we deliver brilliant care? Look, I know this might feel overwhelming, a lot has changed, and let's be honest, CQC hasn't done a brilliant job of communicating it all well clearly. They've been too busy firefighting their own problems. But here's the good news. Once you understand the new framework, it's actually quite simpler in many ways. 34 quality statements instead of 300 plus prompts, more emphasis on professional judgment instead of mechanical scoring, and more weight given to all the voices of the people who actually experience your care. If you're delivering great care, and I know most of you are, the new system gives you more ways to prove it, not fewer. Providers who will thrive under this framework are the ones who collect evidence systemically across all 6 categories. Those who prepare their staff to speak confidently about the care they provide, who build relationships with partner professionals, and who treat feedback as gold, not as a nice to have. In the next episode, I'm going to dive deep into the 6 categories, and I'll show you exactly what inspectors are looking for in each one, the weight each carries, and why most providers are completely missing 4 of them. If you found this useful, hit subscribe so you don't miss it. And if you've got any questions, drop them in the comments. Thank you for watching.